Hi, I'm Tyler Goldberg. I'm a fellowship-trained arthroplasty surgeon with over 25 years of experience. I'm specializing in joint replacement surgery, and over the course of my career, I've helped literally thousands of patients get back to their life and regain mobility and quality of life. I'm also the founder of Austin Orthopedic Institute and a concierge program that's helped hundreds of patients each year receive personalized, high-quality care. Whether you're considering joint replacement or just exploring your options, I'm here to share insights, answer your questions, and guide you through your journey to better movement and better living. And today, I want to talk about value, and in particular, the definitions of value in healthcare. So I think if we're going to talk really about value and what really matters in healthcare, I think we have to take a few minutes to define what value is in healthcare and how we talk about it currently. And the value equation was given to us by Michael Porter out of the Harvard Business School, who simply told us that value is outcome divided by the cost. And this seems easy enough, right? If you want something that's of high value, you want to have a great outcome with low price. So you want to increase the numerator, decrease the denominator, and that's going to give you a nice high value. However, in my opinion, there's a lot of things that are wrong with this value equation. First off, it oversimplifies what the definition of value is, right? This is a very subjective measurement. This is different in each person's sort of feeling or scope when they're seeking out some sort of healthcare outcome. And the other thing is outcome is truly subjective as well. What is a great outcome to one person may be a terrible outcome to another. So if one person gets a great outcome and the other person has the exact same outcome, but it's not great to them, is that of high or low value? The other thing that would be difficult is how do you actually measure outcomes in the current healthcare environment? So there's so many grading scales and scales that are subjective and put in by the patient. There are outcome measures that are put in by the physicians. What is true data to determine what the value actually would be? Data management is often very difficult, and how would you harness the power of using that data to determine what is high value or not? The other thing that gets left behind in this type of system is the cost side of the equation. So let's, for example, pay attention to a patient that is, has lots of comorbidities, has high cost to healthcare system, but yet they get a great result. Do they have decreased value because they are high cost to the system? This current formula sort of undervalues, if you will, those high demand patients because high cost patients decrease the overall value. The other issue for this is it assumes that everything has to be integrated in the healthcare system. In other words, the outcomes and the costs are directly integrated, which is really only possible in healthcare systems. But in reality, the United States healthcare is very fragmented. There's lots of different players in the field to determine the value each time a patient has any type of outcome or any type of procedure or any type of activity where there should be an outcome, a cost, and consequently a value. The other last issue I would kind of talk about is this is sort of rooted in market-based principles, right? This is a very simple equation, and what this is going to do is commoditize everything. So you're always looking for the lowest cost denominator. And I just don't think that this is a great way to determine value. It promotes competition rather than collaboration. I think the better way to look at value is with an Alex Hormozi definition. Alex Hormozi is sort of the founder of this particular value equation, and he's very aligned with business principles and looking at value in terms of customer success. And what he defines value is simple: your dream outcome times the likelihood of achievement divided by the time delay times your effort, or what's called your sacrifice. And if you're a patient, this sort of accounts for physicians in the healthcare system. So if I'm looking for value when I'm looking for a knee or hip replacement, this is the value equation I'm going to have. I'm looking for my dream outcome. What do I want to do? I want to get up and walk without pain. I want to sleep without pain. I want to get on the floor. And I want to have a high likelihood that I'm going to get that outcome, right? That's important to us. And I want to do it fast because I'm tired of being in pain. And I also want to do it with as little effort or rehabilitation to get that dream outcome. So we want to increase these, decrease these, and that gets us true value. Well, this actually has room for the doctor. So the doctor's not going to create the dream outcome for the patient. This is something that the patient's going to come in and say, I want to do this. But the doctor can absolutely influence all three of the other. And this accounts for a better description of value to me. The doctor with lots of experience, the doctor that knows what he's doing, is fellowship trained, et cetera, he's potentially going to give somebody a higher likelihood of achievement. If you're looking, for example, a plastic surgery to do a facelift, are you going to go to the plastic surgeon that's done 20 or the plastic surgeon that's done 2,000? Even if the plastic surgeon's done a little more expensive and has done 2,000, you're going to pay for that mastery or that element of experience that that person would give. A surgeon can also work on doing a time delay, and meaning he can get you in faster for surgery. So obviously some surgeons have longer delays till surgery. Some surgeons are able to get people in sooner. And then the effort and sacrifice is directly influenced by the techniques in which that surgeon would use. So I would tell you, you want a master trained surgeon that's been doing it for a long time, that knows exactly what he's doing to minimize your effort and sacrifice as far as your rehab, and you want them to be able to do it fast. And that's why I have created a concierge program to be able to accommodate and harness that mastery for these patients, because I can directly influence these three. And that's who I'm trying to help the most. I hope that's helpful. Hope you have a great day and you get out of pain and back to the life that you want to live.